Dr. Fauci, could you explain the difference between the emergency use approval of a vaccine and the final use approval of that vaccine? Because I've been hearing some hesitancy based on what is a perceived distinction in that, and I'm not sure what the distinction is.
Well, there is a distinction, but it's really very nuanced, and that is the emergency use authorization looks both at the efficacy and the safety. And the safety is a pretty good gauge because you will not get an emergency use authorization until you wait 60 days following the time when half of the people in the trial have gotten their last dose. We know from experience that the overwhelming majority of the long-term effects are within 15 to 45 days following the dose. So if you wait 60 days on the emergency use authorization alone, you're in really good shape with safety. The BLA, or the biological license application, or the full approval, usually waits several more months just to make sure, extra sure, with regard to the safety. But we feel very comfortable now about the safety of those vaccines that have received emergency use authorization. So it really is a matter of waiting a few more months to really nail it down. But we shouldn't hesitate, because I know there are people in the audience, I'm sure, that are saying just that. Why don't I wait till it's fully approved? The safety and the efficacy now is very, very firm, which is the reason why all of us strongly recommend that if you're within the age group that can be vaccinated, that you get vaccinated. It's safe and it's highly effective.
Some members of our audience have been attending this virtually tonight. We're going to take a question from one of those virtual audience members attending. Dr. Rodriguez in Florida, go ahead.
Hi, I'm Dr. Norma Liz Rodriguez. I'm a pediatric emergency physician at Johns Hopkins All Children's at St. Petersburg, Florida. Over the last months, I've seen an increase in the number of COVID-positive teenagers with severe respiratory symptoms requiring ICU admission, which is something I hadn't seen before. I'm hopeful that increasing vaccine accessibility to this population will improve this. But as one of the only primary Spanish-speaking physicians in my group, my biggest concern is vaccine accessibility amongst non-primary English speakers. What are we doing to improve vaccine accessibility and the vaccine appointment process for non-primary English speakers, many of whom already struggle to navigate our complex medical system?
I can try to tackle that one. Dr. Rodriguez, one of the first things I'd say is, can you give us your phone number and your contacts so we can work with you to make sure we reach out to that population?
I would love that.
Secondly, what I can tell you is that President Biden has essentially instructed all of us to make sure we go to where you are, where the people who need to be vaccinated are, not wait for you to come to us. Because we know that at this stage, some of those folks are just having a hard time getting to us. They may work long hours. They may have responsibilities at work and at home that make it very difficult. And they can't figure out how to navigate the system. They may not speak English very well. All of those things, we're not going to wait. Later this week, I'm going to be going to a site. It's a small site in the Central Valley of California, where it's mostly agricultural families. And we're going to reach out to them because we know many of them would love to get vaccinated. They just haven't had the opportunity to go to the site. So we're going to go to you. And before this town hall is over, we need to make sure we get your numbers so we can have you help us get to those people who trust you. They may not know us, but they trust you.
Thank
you, Secretary Becerra. Precisely 1 in 5 essential workers are afraid to get the vaccine because they are concerned about the side effects and missing a day at work. What would you say to them?
Well, I will say to you that President Biden has already asked a lot of these employers to give some of their workers a day off so they can actually go get vaccinated. And if they can't take the day off, then, as I said, we're going to go to them. We want to know where you are. Tell us. We are now setting up mobile clinics to do vaccination, so we'll go to you. We're doing what are called pop-up vaccination sites, where on any given day, if we got a pastor who says, hey, my church is available, I'm going to have my parishioners coming in, let's do something, we'll do it. Farmer, there was in the news reported that a farmer said, I can get a whole bunch of my community folks to come on in, and he was able to vaccinate several hundred people just by setting up a site around his farm. We're going to go where you are because we know at this stage it's up to us to help you. You're not paying a cent. And so help us find you because we want to get you vaccinated.
Thank you very much. We have another question from the audience.
Hi, good evening. I'm Melissa. I'm interested in knowing more about the concept of herd immunity and this idea that the vaccine not only protects me, but also others. Could you tell me more about how the portion of the population that is choosing not to be vaccinating harming others?
Dr. Fauci?
She's asking about her.
How is
I didn't hear her very well.
The people who are choosing not to get vaccinated, would you describe them as being a harm to other people?
No. No, Melissa, we don't ever want to accuse people or make them feel guilty. We want to embrace them and try and convince them if they're recalcitrant and don't want to get vaccinated. Try and find out what the reason for that is. Reach out to them, even if it takes a trusted messenger, maybe not me, maybe someone who they trust in the community, a clergy person or their family physician, to get to ask them why it is you don't want to get vaccinated rather than making them feel guilty, because you'll never win them over if you do that. So our tact is to try and reach out and try and give the good rational reason why it's necessary for your own protection, for that of your family, and really as your societal responsibility to keep the entire community safe.
Thank you so much, Dr. Fauci.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.